sleeve gastrectomy, typically the weight loss in a sleeve gastrectomy is about an excess weight loss of approximately 60%. And so what does that mean exactly? What is excess weight loss? Excess weight loss is the weight you have above your ideal weight. So say you on ideal body weight tables, you're supposed to weigh 150 pounds, but you actually weigh 250 pounds. Well, you're 100 pounds over your ideal weight. So with a sleeve, you're projected to lose about 60 pounds because it's 60% of that 100 pounds. So it's 60 pounds of your excess weight. If you were to have a gastric bypass, you can lose 75%, so 75 pounds of that excess weight. And then for a lap band, on average, you lose 45 pounds or 45%. And so, you know, so those are all the kind of in the clinical data, that's kind of where, you know, sort of the minimums or the ranges are for weight loss for the different procedures. So definitely the sleeve is kind of in the middle of the band. It's almost towards the bypass, but not quite there yet. We do the sleeve gastrectomy in different types of patients. Initially, actually, the sleeve was approved by insurance companies pretty much for only a few reasons. One is your body mass index was over 60. Also, for patient, that was pretty much the only reason that I would approve the sleeve gastrectomy is if your BMI was over 60. But now insurance companies are approving it for a standalone procedure. And so sleeve gastrectomy is actually approved by more and more insurance companies. So definitely if you're interested in that, we can talk to you about that and make sure that your insurance covers it. Patients we also do the sleeve in is patients who are high risk. For example, if you're taking Coumadin because you have atrial fibrillation, or you're taking blood thinners, aspirin, you have like cardiac issues and stents or bypasses, it's best to do probably a sleeve gastrectomy, because one thing that can happen if you have a gastric bypass and you take aspirin or you take Motrin or you take naproxen, something like that, and you have to be on that because you have maybe rheumatoid arthritis, it can cause ulcers. And what these ulcers can then can happen with these ulcers is they can then pop or perforate. So definitely, if you have a gastric bypass, you don't want to take aspirin or any anti-inflammatories. But for a sleeve, you can take that. So if you do take these chronic anti-inflammatories, that's the NSAIDs, then we would prefer to do the sleeve gastrectomy on you. Also, if you have big open abdominal surgeries where you have a lot of scar tissue or adhesions, where it's very difficult to pull up the small intestine to the stomach pouch, it would probably be best to do the sleeve, because all we have to do is work up in the upper belly and not worry about all that scar tissue.